All right, good afternoon, everybody, and thank you for joining today's presentation. Today's presentation is on the streamlined process for permanently adding telemental health services. My name is Boris Vilgorin, and I'm with MICTEC, and I'm happy to say that we have Amy Smith from OMH, specifically from the Bureau of Inspection and Certification, that will be conducting today's presentation. As with all of our presentations, we strongly encourage folks to chat in their questions throughout the presentation. We did put some time aside at the end, and we'll try to get to as many questions as possible and answer as many of the questions that are possible as well. Before we jump right into the presentation, just wanted to do some basic, our usual housekeeping. Again, as always, this presentation is being recorded, and both the recording and the PowerPoint presentation will be available on the MICTEC website. So just wanted to let folks know. Again, we are recording and we'll be making this available for all. And also just again, as I just mentioned, please make sure that you chat the questions in. This presentation is based on recently released OMH guidelines around telemental health services that Amy will take us through. So with that, I'll turn this over to Amy Smith.
Thank you, Boris, for the introduction. Thank you also to MICTEC for hosting this webinar and for helping us to moderate the Q&A at the end. For the next hour, we'll take some time reviewing the streamlined process for permanently adding telemental health services. I'm going to go through a quick review of the guidance, and we'll be sure to leave plenty of time at the end for the Q&A. A number of my colleagues at OMH who work in the Adult and Children's Division have joined me today to help answer some of the more specific questions that may come up. And for any questions in which we don't have an answer, we will bring it back to the larger group at OMH for review, and we will follow up with answers to individuals and providers. I do want to mention up front before we get started that just a reminder, the primary focus of this webinar today is on the streamlined guidance document. We're not able to speak to whether the current executive order will be extended. We do remain hopeful for further extensions, and in the meantime, we are working on reg changes to make permanent some of the current flexibilities. And I'll touch on that a little bit later in the webinar. So OMH issued this streamlined guidance on July 24th. And the purpose was to simplify the approval process to add telemental health as an optional or additional service. OMH wants to ensure that providers are able to continue providing telemental health services beyond the disaster emergency. The guidance does apply to OMH licensed and OMH designated providers, as they are already covered under Part 596 telemental health regulations. The process to apply for the OMH designated providers will be addressed later in the webinar, but it should be noted that the required documents are the same. The streamlined process allows for the OMH licensed providers to now submit one administrative action, or AA, per agency. The agency will choose one program in the program listing to submit the AA under. It must be clearly identified which program sites, including any satellites, which are to be included for approval. It may be easiest to complete a separate page or document listing out all the applicable sites, and this document should be included as an attachment within the AA. These AAs are submitted in MHPD, which is the Mental Health Provider Data Exchange. It's the same system that's used for a change of hours, change in population, etc. The AAs should not be submitted under the facility level in MHPD. And providers should be submitting by agency, not by sponsor. So for example, if there's a sponsor with 3 agencies, there should be 3 separate AAs submitted. You do still have the choice to submit your AAs by program type if desired. If you'd rather not submit everything under one agency AA, it is fine if you want to submit separately by program type. So for example, a clinic program review may be slightly faster than a review for an ACT or a PROS program. So if you're submitting all of those programs under one AA, it just may take a little bit longer for that review to go through. You should consult with your field office to determine which option is best for you. They'll be able to take a look at the programs that you have and advise you on the best way to submit that AA. If you already have some sites that have been approved through the AA process to offer telemental health, and you now want to add additional program sites, you do need to submit a new AA. And this new AA should include a list of all the new program sites to be included. If you have AAs that were submitted prior to the streamlined guidance, but they're still under review, please be in touch with your field office to discuss the best option. If it's early in the review process, it may make more sense to cancel those AAs and then submit just one, or if it's later in the review process, it may be easier to just submit an additional AA to cover for those new program sites. Your field office will be able to help you determine which is the best option for your particular situation. As outlined in the November 2019 Telemental Health Services Guidance document, as part of the request to add telemental health, providers do need to complete Appendix 1, which is the attestation of compliance, and include a policy and procedure document as part of the AA submission. If an agency is listed for more than one program type, the policy and procedures should be reflective of utilization of telemental health within the different program types or settings, in accordance with applicable OMH guidance or regulation. So for example, if your agency is licensed for clinic, PROS, and ACT, the policy and procedures should have separate sections that speak to any specific procedures for each different program type. The policies and procedures must be reflective of current 596 regulations, not the current flexibilities allowed under the executive orders. And the reason for this is that once those orders expire, Part 596 regulations are in effect and they must be adhered to. As part of the application, the field offices may request to see a copy of the informed consent for review. And just a reminder that you can develop a separate informed consent for telemental health, or it may be embedded in your general consent form. Either one is fine. In Appendix 2, which is our technical guidelines checklist, it's no longer required to be submitted as part of the AA. It can be used now instead as a guide to help you in purchasing equipment or choosing a platform that meets the minimum requirements. And one last reminder, there is no requirement for pan, tilt, zoom since we made the last regulation amendments in July of 2019. OMH is currently exploring amendments to Part 596, and we're looking at the current flexibilities allowed under the executive order, as well as federal flexibilities, to see which of those we can make permanent. Some of the potential changes include expanding the list of practitioners, expanding the location for practitioners where they may be physically located outside of New York State, removal of the in-person assessment requirement, expanding use within ACT and PROS, including use for involuntary admissions and use of telephonic. Although specific to telephonic, this does require additional approvals outside OMH to allow for reimbursement. When the future regulatory changes occur, you will not be required to submit a new AA to take advantage of those changes. You'd simply need to be in touch with your field office and let them know about the changes you intend to make, and the field office will advise you of any needed documentation to facilitate that change. And this may include a request for updated policies related to telemental health and the ways in which the new regulation changes will be implemented at your agency. This is part of the reason why it's really important to get those administrative actions in now, so that you get kind of the bulk of that review process done up front. And then you can simply make a change to your policy and procedure once we make some regulatory changes. In regards to on-site staffing, it is the expectation that the program, site, or agency will have an on-site staffing policy for the licensed location. One, to ensure that all required and optional services can be delivered, and two, to ensure that recipients have the option of in-person care when requested. It should not be an expectation that all clients will receive services via telemental health. This determination should be based on recipient choice along with a clinical evaluation. And it's important to note that we don't expect, especially post-COVID, that programs would be fully remote or fully virtual. For Part 596 regulation states that the field office may conduct a remote readiness review prior to final support or approval of the AA. Pre-COVID, these reviews were happening for all hub and spoke sites, and OMH did recognize that this was a significant burden placed on programs, especially now that so many are working in different locations, potentially on different days during the week. And so as a result, in most cases, that remote readiness review will not be needed. You should talk with your field office about how this will work in your particular region. Many field offices have home office attestations or tracking forms that you can complete and keep on file, and the field office can provide you with a copy of these voluntary forms for your own use. And OMH designated providers don't have the ability to submit an AA, so they would need to submit their request to utilize telemental health on a permanent basis to the field office, and that would generally happen via email. Just as a reminder, the same documents are required, so that's Appendix 1, which is the attestation, and the policy and procedures. Before submitting that request, check in with your field office because there may be an option to submit your list of designated providers as part of an agency AA for single review. Some of the field offices have been looking at whether this would be a more viable option, so it's definitely worth checking in with them first before you submit anything. If you're unsure as a designated provider if you should submit a request at this time, you might want to ask yourself the following question. Are you able to meet the regulations as they're currently written? So for example, do you employ the eligible telemental health practitioner types as listed in Part 596 today? And if so, you should put in a request now. If not, you may want to wait until the regulations have changed since you'll be unable to write a policy and procedure that would align with the current regulation. And that's kind of just our full and quick walkthrough of the guidance that came out. And I think we'd like to turn it over to try to open it up to more specific questions because, you know, the guidance isn't always, it doesn't always describe every scenario, and every scenario can be slightly different, and sometimes it's helpful to kind of walk through what those might look like and see if we can help to come up with some answers going forward. So Boris, I think I need to turn it back to you to help us to facilitate the Q&A.
Yeah, definitely, and thank you, Amy, for running through that, and you know, kind of reviewing the guidance that was provided before. So we have received some questions already, and again, I will encourage folks to continue chatting the questions in, you know, and we'll try to get to as many as possible during this call. I also just want to remind folks that, well, again, we are recording this, and this presentation will be available, including the slides, probably in the next couple of days or so. So again, just wanted to mention that. So that being said, let's just jump right into some of the questions that we got so far. The first question we got is, does the permanent mental health guidance process also apply to a CDTP, or CDT, as I remember them?
Continuing day treatment programs? Yeah.
Correct.
I don't know if anybody on program would want to speak to that at all, or if you guys give them an opportunity to jump in, and if not.
Okay.
Oh,
and also
okay. I was just going to say, yeah, we don't have any program types that are excluded by Part 596. We will be coming out with some further guidance around what telemental health may look like and the way it's delivered by program, but it's not excluded within the regulation.
All right. Excellent. Thank you. And I just want to also just mention to our colleagues from OMH that might be on the phone, just pay attention. You might be double muted, meaning both on WebEx and your phone. So if you are just trying to jump in, just make sure you unmute on both ends, because that happens to me constantly. So in a similar vein about program, this is specific to children and family. There's a couple of questions actually about CFTSS. So one question really is about, is CFTSS program eligible and included in this? And if it is it just for any particular level, meaning like OLP and CPST, which is the licensed services, and is it also available for PSR, YPI, and others which are maybe not licensed?
So I can start to answer that, and then if anybody from Children's wants to jump in. But the way the regs are as of today, it would need to be those licensed services, because those are the eligible practitioners that are covered by Part 596.
Right. Thanks, Amy. This is Meredith, and absolutely, for example, other licensed practitioner has licensed practitioners that would qualify under 596, but services like CPST don't require a licensed practitioner, and PSR and peer services are also services that are not usually provided by licensed practitioners, so they wouldn't be captured under the regulation.
Okay. Thank you. Thank you for clarifying. We got a couple of requests actually. If OMH can share or has any policy and procedure templates that could be shared for providers to use.
We don't have a template that we can share, but what we have advised is that if providers follow along with the attestation, that kind of gives you a guide for how to write your policy and procedure. It's asking you to attest that you've included certain standards within that policy and procedure, and it does ask you to identify the page number. So if you just kind of follow that as a guide, you know, most policy and procedures look the same. It's just some have a little bit more detail than others, but we don't have a template, no.
Okay, thank you. Another question that came in about Part 596. And the question is, does it still require that the individual provide the service or be located at an office location, or is it flexible enough where people can do it remotely, for example, like practitioner's home?
Yes, that was actually an expansion with our regulation in July of last year. We expanded for the practitioner could be located in a home office, and that the prescribers could actually be anywhere in the U.S. The other licensed practitioner types had to be in New York State, and we also expanded so that the client could be located in their home. So that was already included, and yep.
Excellent, thank you. And the same thing, you know, I think applies to, there was a question about, is it just for psychiatrists? And I believe that has been extended too, that now includes other licensed individuals, and there's a list, right, that OMH has and who's included?
Correct. Yep. If you look at Part 596, telemental health practitioners will list out all of the currently eligible practitioners that can deliver services.
Excellent. Question about timing. Is there a deadline for submitting this paperwork with AAs?
There's not a timeline, but I think just keep in mind that we don't know when those executive orders could end. And if you want to make sure that you have telemental health on your operating certificate, at least to cover for what currently 596 allows, it would make sense to get it in sooner rather than wait until the EO expires. Because once that happens, if it's not on the operating certificate, you really can't deliver services in that way. So it would make sense to get it in now. That way we have time to process it, ask questions if we need to.
Okay. Yep, makes sense. And there's probably no simple answer to this, but is there timelines for how long it takes to get the approval for an AA? I suspect that each case is probably different, but.
Yeah, it really is very individual. I think it depends, especially now that we're looking at processing them as an agency-wide AA, if they're not broken down by program type. It depends on the size of the agency. But I do know that the field offices, we've been getting the approvals in every week in larger numbers, so they are moving through pretty quickly. And now that we've removed kind of that need to do the remote readiness review for every site, sometimes that's what would slow it up a little bit. So they seem to be moving through pretty quickly, and we're aware of the timeline and the extent or the deadlines on the EO as well. So we're trying to get them through as quick as we can.
That's great. Thank you. All right. So we have this question that could be either adult or children, and I'm going to say we'll make it for both. So the question is, how can HCBS, and they didn't say adult or children, submit the request for telehealth services? So maybe we can break it out because maybe the answers are different.
Does anybody from program want to take that, or you want me to?
So I will jump in real quickly because this is easy. HCBS for the children's services are under the purview of Department of Health, so they would not fall under this construct under OMH.
Okay, thank you, Meredith.
And for adults, you would email the field office. You would fall under the designated providers. So in the guidance where it says you would email the field office to initiate the request, that's how you would begin the process.
Yep, and definitely reach out to your field office ahead of time, and ask those questions because they will help to guide you through that process.
All right. And back to actually, we talked about who is eligible from the practitioners. Is there a particular place at our OMH website where that list is available? Was that part of the guidance that went out? So there was a question of where I can find a list of qualified practitioners.
Oh, yep. If you go to our OMH website, you can do a search for telemental health, but you could also do a search for Part 596, which is the telemental health regulation. And then it's in 596.4 in the definition section. There's a definition for telemental health practitioners.
Got it. Thank you. I actually got a couple of questions about individuals being served who might now be temporarily residing out of state. And is there, and can a provider continue doing, clearly telemental health, providing those services even though the individual at the moment is not in New York?
So that one I'm going to try to actually break it apart because there's a couple of different answers. So there's under COVID, which, looking at what allowances that other state might have in terms of practitioners seeing somebody when they're in another state. So there's that piece of it. But then our regs do allow, pre-COVID, they would allow for an individual to temporarily be located out of New York State and still stay connected with their provider here. And we built that in for individuals maybe that were at college or taking care of a family member. And certainly now with COVID, it makes sense as well. So they are allowed to be temporarily located, but you really need to check with that state to see what their rules are around being licensed in that state and if you're delivering services. Because we can't speak to whether the other state will potentially have some issue if it's for a long period of time. So it makes sense to check with that state to see what their rules are around that. But it is allowable per our regulation.
Right. Excellent. Thank you. There's a question about, there was a mention of a home office attestation, or there is a home office attestation. And I guess the question is, does OMH have a template on that, or maybe a little more clarification about the home office attestation?
Yep, the field offices actually have copies of that, and I believe that they're all using the same template. So if you reach out to your field office, they can share that with you.
Excellent. There's a question also about if residential programs, if this applies to residential programs.
I'm going to let Julie, I think she's on, I'm going to let her take that question. Okay, I saw her on with us.
Yeah, hopefully the mute is off.
Yep.
You hear me?
Yeah,
you guys hear me?
Yeah, there you go.
Yep.
Yep.
Okay, sorry about that.
Okay.
Our emergency COVID guidance expanded telehealth to residential programs. However, we didn't require the same attestation and approval process. So as we move forward and look to revise the telemental health regulations post-COVID, we may look to include residential programs in that process. But at this time, there's no need to submit an administrative action for approval.
Got it. All right. Thank you. Just in regards to kind of those additional changes that might be coming down, one, there was a request if you can maybe quickly, or a couple of requests, go through those, and also if there's any sense on timelines or when that might be happening.
I missed the beginning part of that, Boris. Can you say that again, the timeline for the change of reg? Is that what we're talking about?
Yeah, the additional pieces that you guys are looking at, what they are, if you can review them quickly again, and also what potential timelines might be.
Sure.
Yeah.
So, we've been working on some drafts. We don't have a set timeline at this point, but we are hoping soon. And what we're looking at is trying to keep in place some of those flexibilities that we saw come through with the executive order. So expanding the list of who's eligible to deliver the service, no longer having the limitation on some of the practitioners sitting in New York State, so they could be sitting in a different location when they deliver services. We're looking at removing the in-person assessment. So we still want there to be an evaluation to determine if somebody's appropriate, but it no longer has to be in person. So it could be, via video or telephonic if allowable. We're looking to expand on the use within ACT and PROS. We want to include use for involuntary admissions, which is something that we were looking to do even pre-COVID. And then the telephonic piece, of course, we're looking to include that as well, but we do have to wait on some approval outside of OMH, which could be tied to the reimbursement for that piece.
Got it. Thank you. And any potential timelines, I guess, still in the works, or?
Yeah, I mean, we have drafts, and we have executives looking at them, and we're trying to push things through as quickly as we can. And that's probably the closest I can get to a timeline.
No, understood. So there's a number of questions, I guess, regarding the whole licensed versus unlicensed and so forth. So maybe, and I know there's differences between under the current COVID situation, because I think we're getting some questions of concern about, we were told it's okay to do, like, for example, back to CFTSS and PSR versus kind of what I think you're talking about is permanent, ongoing. So maybe if you can spend a minute or two again, kind of separating the current status with kind of the COVID, and I know you've mentioned it and others already about COVID versus ongoing, and when, the permanent quote unquote hits and the COVID rules kind of, if I can say, go away. Can you just talk a little bit about it again, that because we're getting a whole bunch of, I think folks maybe questions about today they might be doing something wrong, which I don't think they are, but if you can kind of clarify that.
Sure, and I mean, I'll start this, but certainly others from program if you want to add to this, but the executive order and a lot of things that we've put in place and guidance for COVID, during the COVID emergency, allow a lot more flexibility in terms of who can deliver services, who can be sitting where. It's very, very broad. So chances are what you're doing today is perfectly acceptable as long as it's falling under the executive order, which we're still under until September 4th. What we're talking about is, writing these policies and procedures and things that would be covered post-COVID. Which we don't know when that will begin, but, lining up with what the regs currently say today and what's allowable. And those are two very different things.
That's
and
great.
Program
Thank
may
you.
want to jump in on that. Yep.
Anybody from the program side wants to add anything? Okay. Oh, good. Thank you.
No, I did want to add,
sorry.
Boris, that
go ahead.
We are, working with other state agencies and the governor's office, and we're hopeful that executive orders will be extended again. Although, so we're not anticipating that the flexibility that we have in place will lapse. However, it's among many things aren't directly under our control.
Great, thank you, Chris. And I think there was a couple of questions about why should I do it now versus waiting where there's more guidance and regulations. I think Amy covered it number of times, and again, just to highlight again, the timing of this. You want to do this now because currently it is set to sunset in early September. Hopefully, as Chris said, it'll get extended again. But this really gives an opportunity for folks to do this now before any potential changes could happen, rather than go through kind of a rush process and make sure there's no gaps in there. So definitely, as I think Amy and others already have said numerous times, please take advantage of this kind of earlier process and moving this forward, rather than waiting for other regulations or other things that might come out. We also got a number of questions around technology and which platforms are going to be okay, which platforms are not going to be okay. Can I use Zoom? Can I use that? And so there's a number of similar questions. So any thoughts on that, on the new kind of permanent regulations, what would be required or acceptable?
So we don't approve or disapprove platforms necessarily, which is part of the reason why we developed the technical guidelines checklist, which we had someone from ITS help us to develop to really guide providers in purchasing something that would align with what the standards are and what the minimum requirements are. I think one of the most important takeaways to be aware of is that you need to be able to get a BAA or a business associations agreement so that you are covered. That, there's been some issues with Zoom and Zoom Healthcare will give you that BAA, so they are an acceptable platform, but some of the other ones don't have the same standards in terms of encryption and security. So it's just really important, to be aware of those types of things.
Excellent. Thank you. There's a number of questions, and again, I just wanted to, and this adds to what Meredith said. We had a couple of questions about OCFS, 29I, and a couple of other non-OMH, I guess, would be programs or licensing. And I just want to say it loud, and Amy and others please confirm, what's being discussed today applies to OMH only, not other, like Meredith said, children's HCBS is under DOH licensing or preview, so this wouldn't apply. Same thing, 29I is an OCFS licensing, so I suspect this would not apply there as well. Providers should look to OCFS for guidance there, and anything related to that. And so we have a number of questions, especially around foster care and 29I, but a few others. So I just want to again repeat, this is OMH specific. So Amy, just want to confirm that with you. I assume that's correct?
Yes, yep. And
yes.
Meredith, please chime in. Yep,
thank you.
Yeah.
Thank you, Boris. I'm not seeing those questions, so I appreciate you calling them out because they don't all show up. But absolutely what you said is correct. I will say, just as a small caveat, obviously, that for the CFTSS specific services, our expectation is that we will be kind of talking with our other state agency partners in regards to the applicability of telehealth for those services, particularly for more broadly outside of those that can be provided by licensed practitioners, so that we're all kind of on the same page and ideally all able to issue comparable policies wherever possible. But I think that it's important to note that we are having conversations, and we'll be having continuing conversations with our state partners in regards to telehealth and our views and our applicability, and certainly the information that we've gleaned from providers about their successes and shortcomings and all of the wonderful detail that we received through the surveys that everybody was so gracious to complete over the last couple of months. So I will say that what you said is true, but I will say more broadly, we are going to be having those conversations. So hopefully more information and detail it will be pending in regards to that.
Excellent. Thank you. Yeah, and we also had to say a number of questions around OASIS and kind of the substance use, because I know a number of providers are duly licensed on that end as well. So again, just just wanted to highlight that. So this is OMH focus specific. There was a question though around non-OMH license, but contracts that providers might have through their LGUs, the local governments, that is OMH kind of funding. And I guess that would be probably fall under the designation category, or are they excluded from this at this point? So it's a little bit down the rabbit hole and very specific, but just we had a couple of questions that came up around that as well.
Yeah, if you could, well, I think you might send us a lot of the questions, but if you could send us those ones specifically, we might just have to tease out, because there's OMH funded and then there's the OMH designated, and the designated are covered under the regs. Outside of COVID, funded is covered under COVID, so it gets a little bit more muddled. So I think maybe if you could send us those, we can try to tease it out and follow up with those individuals.
Of course, definitely will do. And there's a number of questions about consents, and if the current, I guess, flexibility of verbal consent would continue under this, or would there be any specific requirements under the kind of the permanent guidance?
What we've been told by council is certainly that the verbal consents, we know it's acceptable now during COVID, and there may be some instances post-COVID where you get verbal consent, maybe if, that person hasn't yet come in to meet with somebody, but that the effort should always be made to get that physically signed consent from that person at some point. So
Okay, got it. And not surprisingly, quite a number of questions on reimbursement and payments. And will that remain, or is there any thoughts on changes as this might, change from COVID to permanent?
I'm going to see if anybody else has thoughts on wanting to answer that.
I'll take that. I mean, there's no current expectation that the billing will change.
Got it. Thank you. Appreciate that. We also had a question, a couple came in, I guess, from the state-operated facilities, and if this is applicable to the state-operated facilities as well.
It is, and they should have a contact within state operations that they would, like a liaison. So they should follow up with that person, and they will inform them on, how they're applying. I think they may have some templates that they use for the state operated possibly. So definitely follow up with your state ops liaison before you start submitting an AA or anything.
Got it. And
Boris,
this
is Chris. Can I jump back to the billing question? So there's actually two related answers. I'm not exactly sure what they were thinking about, but as far as being able to bill and being reimbursed for telehealth at the same rates that you're reimbursed for in-person services, we certainly anticipate that to extend going forward. We've also issued billing flexibility during the COVID disaster. And while we have no immediate plans to sunset that guidance, we may be looking at modifying aspects of it going forward. But until you hear otherwise, there are no changes to really any of our billing guidance that we've put out so far.
That's great. Thank you. Yeah, because there was definitely questions about reimbursement, but also even the billing codes and everything. So I think that the answer is at the moment there's no changes, anticipated. So that's good. Thank you. I'm just, we do have quite a few questions, but a lot of them I think are in very similar kind of way in regards to what we covered already in many different ways. So I just want to quickly scan so this way we don't repeat ourselves. But in meantime, is there maybe other folks that's from OMH that are online that wants to jump in and add anything, or Amy, as we were kind of asking questions, and anything else that jumped out at you that you want to highlight in the next 10 minutes or so while we have a little time?
Yeah, I did see a chunk of questions that came in specific to pros, and I didn't know if anybody from OMH wanted to say anything or not at this time, but just to kind of acknowledge that. I'm trying to look at some of the questions that came in. One of the other ones I'm seeing is that I'm not entirely clear with this particular question, but they're saying if they are already submitted for telehealth under 596 and have it. I mean, if they submitted pre-COVID and they have telemental health on their operating certificate, you don't need to reapply. You're already covered. This would be for anybody that does not have it already on your operating certificate. So if you just did the self-attestation in March that we put out as part of the emergency guidance, that did not result in, an amended operating certificate. That wasn't giving permanent approval. It was just giving approval during the emergency period. So for those individuals, you do need to apply. But if it's on your OC, you're covered. You're good to go.
Amy, would somebody who was approved before, but maybe for a limited array of services within their agency, and if they were approved for clinic or now adding pros or something like that, would they need to update their policies and procedures to incorporate the new services?
They can, yeah. If they were not delivering, if they were approved before, And they would have had to have already put in for PROS or ACT and have it on their OC, because that's its own, it would have been its own separate application. So really it's just, if you want to add new sites, you do need to put in that new application and that new AA. But if you're delivering it, you've already been approved, it's on your OC. Once we make some reg changes, you'll want to reach out to your field office about probably updating those policies and procedures to be reflective of the, current regulation. I'm not sure if that answered your question, Chris, but.
Yes, I think so.
Okay.
Yeah. All right. So another question came in just to clarify, is this applicable to audio and video only as a combination, or can you just do audio, I assume, by phone when we talk about telemental health?
Well, the regs as they're written today do not include telephonic only. They include that kind of audio video two-way. But we are making those changes. But again, just to be aware that we do have to get additional sign-off for reimbursement, but we are looking to include it in the regulation.
Yep. Thank you. And there was also a question, and I assume the answer is yes, that OMH is talking to managed care organizations about all of this, and the managed care organizations are aware, these permanent, status and so forth. So just wanted to throw that question out there as well.
Yeah, yep, we do. And we've been following up where needed if there was any confusion or if they were potentially asking for additional information or documentation. We've issued some guidance around that. So if providers are continuing to have some difficulties, let us know and we can follow up again.
Excellent. Thank you. All right. I think, we did get quite a few questions. I do appreciate, but kind of flipping through them quickly, I think a lot of them, were answered in one way or another. And we definitely will be sharing all the questions with OMH that came through, for their review. And as I mentioned early on, this is being recorded and will be posted, both the recording and the presentation, but also folks should strongly, encourage folks to look at the guidance that was released not too long ago as well, around the 596. And I just wanted, if there's any last, minute words or other things that folks want to jump in from OMH before we conclude today's presentation. All right. Let me just go ahead.
Oh, Forrest, can I? I'll try to do this quickly.
Of course.
But I think I see the questions about like ACT and PROS coming up, and questions about who's allowed and who isn't. So the way the regulation is written today, both of those allow psychiatrist or psych nurse practitioner to deliver the service. So if you're putting in an AA today, under these current regulations, the policy and procedures would reflect that those are the two practitioner types that can deliver the service. We do also have within the reg where those individuals can be located. So for PROS, they need to be in the licensed space, and I'm talking about outside of COVID, not during COVID, but outside of COVID with Part 596. You should still get that AA in if you have psychiatrists or psych nurse practitioners that you want to deliver the service via telemental health. Get that AA in now so that you can get the designation on your operating certificate. Then when we make changes and we expand who can deliver the services and where people can be located, you just simply need to update the policy and procedure. So I wouldn't wait if you're thinking, oh, it won't cover therapists or the individual can't sit in their home. Write the policy and procedure based on the reg today, but then you can do an update and it will be much faster to do it that way. So I just wanted to mention that.
No, that's great. Thank you. I appreciate it. Any other thoughts or comments?
Nope.
All right.
Follow
Well,
up with questions. If people have questions, they can certainly send them in to me in the field office.
yes, definitely. Please do. And I just want to say thank you to Amy for today's presentation and everybody from OMH who joined us and was part of this. Thank you for pulling this together. And again, we will be sending out a notice when this is posted and available. Thank you to all. And thank you and have a great rest of the day. Take care, everybody.
Thank you, Boris.